definitely follow me. I'm not very active on TikTok. My TikToks are not that great, so try to follow me there, but actually follow me on Instagram because that's where I have more fun videos.
Guys, on the best moisturizer for your entire body that is clean, cost effective, and keeps your body so moisturized. What I'm talking about is beef tallow. I know you guys are probably thinking that that's disgusting. I thought that too, but I will tell you, you will get over that disgusting gross factor very quickly when you see how soft and hydrated and plump your skin is after using it. I'm not kidding you.
Okay, so in this video, she's talking about using beef tallow as a moisturizer. Now, I don't even know where they even came up with that idea because I didn't even know what beef tallow is. It turns out that beef tallow is actually the waste product from the butcher of the fat, basically. So it's like the waste product of the meat industry where they're taking the rendered fat. It's liquefied, and then they freeze it, and then they use it as a body moisturizer. And this was like, not even just body, but face as well. So this is like all over TikTok. There are over 100 million posts about beef tallow as a moisturizer. Now, it's shocking that it's used as a moisturizer, but it's also been recommended as a treatment for acne. And these are like young girls that are making these videos where they're putting it all over their face. And what's even worse is that they're making it on their own. So just wait. Let's take a step back though. What is beef tallow? Basically, it is rich in triglycerides. So it is gonna be moisturizing. It's also rich in vitamins A, D, K, and E. Okay, so there's some benefit maybe. The good news is that this is, natural, meaning that it comes from an animal directly. Although if you're into clean beauty, this isn't very clean because it's obviously not vegan and it's obviously not cruelty-free, right? This is an animal byproduct at the end of the day. Beef tallow as a soap has actually been around for a while, and it's actually been found to be efficacious as a disinfectant. And there's some studies that show that it did provide symptomatic relief to mice with atopic dermatitis. So there was a decrease in the IgE levels in an animal model who initially had high IgE levels due to pruritus. So there is like some data to back the use of beef tallow. But this is also like, when I was a resident at BU, we used to have a lot of patients who couldn't afford moisturizers and lotions. We used to tell them to use Crisco, like the butter, as a moisturizer. So I think that essentially what you're seeing here with the improvement in their atopic dermatitis is along the same lines, where any sort of moisturizer is gonna reduce their symptoms. The bad news about beef tallow, as you might expect, it's a skin irritant, it's a photosensitizer, it can be corrosive to your eyes. Most of the time these products are actually prone to going rancid because they're not prepared correctly, because people are actually making this by themselves. And then it's actually not safe for aquatic life, so remember, natural doesn't always mean safe. Now, I wanted to talk about something that actually is not a trend that I saw on social media, but it's actually a trend that happens in my clinic probably like 40 times a day, all day long, every single day. And this is talking about the post-Botox protocol. And I'm really curious to hear what everybody in the room says to their patients to do or not do after their Botox injections. Some of us say, don't lie down for 4 hours, don't lie down for 3 hours, don't bend over, don't do gymnastics, don't go to sleep, wash your face, don't wash your face. I've heard it all from my patients. So let's see what the data actually is. So these are the common things that we often instruct our patients to do post-Botox, but how many of these things are actually real? So there's actually no evidence that changing to a horizontal position or lowering the head will influence lidosis or diffusion. Most of the Botox is taken up within minutes of injection. In the rat diaphragm, there was an animal study that was done, and the half time for binding was about 12 minutes. So really, by the time the patient leaves your office, by the time they've paid their bill and they've walked out the door, the majority of the neuromodulator that you have injected has been taken up by the nerve ending. And so what logic does it make for us to tell our patients not to lie down for 4 hours or don't pray for the rest of the day or whatever it is? So I personally don't tell my patients to do that. Now the interesting thing is, sometimes we used to tell patients, oh, after you get your Botox injections, raise your eyebrows, frown, work the muscle, use it. Does that actually help? Does it make a difference? This was a learning point for me. To be honest with you, I've always told patients, don't worry about it. You don't need to do that. The Botox is going to kick in regardless. But the uptake is activity dependent. So in the first hour, when the Botox is still in that that extracellular space, it makes sense actually to ask them to frown or to raise their eyebrows, maybe a little bit more than they normally would, just because it'll kick in a little bit faster. And then the last thing to keep in mind is that, the big worry with our Botox instructions is just like, is it going to diffuse? Is it going to spread to places we don't want? Ultimately, diffusion is really dose dependent. So, you want to keep your injection points with small units. That's really the most important thing. The way that the patient is positioning themselves afterwards really doesn't seem to matter very much. Okay, this is not a video, but this is surgical face tapes. So there is a very, very popular trend on TikTok nowadays for patients who want to avoid doing Botox and want to reduce their fine lines and wrinkles. They are putting this surgical adhesive tape that's commonly used really by the physiotherapist to essentially stretch their face into the position that they want. And then they sleep with this face tape on. I have had so many patients ask me about this, and the reality is that obviously there aren't a ton of studies about this, but the data, as you might expect, demonstrates that there's really no change in any sort of elasticity of the skin. But, as not surprising, if you occlude something overnight, of course, the skin the next day is going to feel better, right? So the skin roughness parameters, the hydration of the skin, actually does improve with the use of face tape, but it really isn't going to do anything for those dynamic rhytids, the ones that come from, expression. The crow's feet will look better for an hour after use, and the patient self-assessment score was improved for about 2 hours, but really even beyond that 2-hour time frame, even the patients agreed that their wrinkles had recurred. Not surprising, right? Okay, I'm not going to talk too much about the salmon sperm facials because obviously Dr. Samar did a great job of going into the data behind these. So for the sake of time, I will gloss over this a little bit. And then this one, was a trend that I wasn't so familiar with, but Dr. Zainab actually is the one who introduced me to it. So let me see if I can get this video to play. You may need to come back, my friend. Where are you? Can you make it come back? Oh, you're making it move from there. Okay, good. All right. Here we go. So this is a regional trend. Oh, we need
that got the entire Middle East. I don't know if he's a doctor. I think he's an energy person or something. Anyway, he's got all the women in the Middle East using a fork. Apparently, he claims that using a fork to massage your scalp or something is going to stop your hair from graying and it's going to stop it from falling out. The problem here is...
Okay, so the first thing that I want to point out is that, first of all, this is all the rage apparently because there's a doctor in Egypt. But then she says, he may not be a doctor, he might be an energy person. Okay, I don't even know what an energy person is, but that just goes to show you that your patients are getting their information from quacks, okay? Literally, they have no concept of who is giving them information. So it's really important that all of us actually invest a lot of time getting on social media and making videos, not for marketing your practice, not for advertising your lips, but honestly for education. We have a responsibility, and if we don't do it, somebody else will. So that's a side note, but let's talk about this. Can combing your hair with a stainless steel fork reduce the risk of gray hair, premature graying, and also hair loss? I mean, it's obviously wild. Obviously, there are no studies to back this up, but I wanted to try to see, there's got to be some kernel of truth that led this energy guy, to come up with this concept. And the best that I could do was say, okay, well, what can I do to prevent gray hair? Like, I actually, as a physician, didn't even really know much about how to prevent gray hair because I color my hair, so it's not, something I think about. But basically, there is actually a topical solution that they're marketing as Grayverse solution that's been shown to reverse premature hair graying. And basically, this is a topical formulation of palmitoyl tetrapeptide 20, which is a biomimetic agonist of alpha melanin stimulating hormone, okay? And so it's been shown to help preserve the function of the follicular melanocytes and promote hair pigmentation, thereby reducing the hair graying process. So here is this case report where they used it. And so this patient had premature graying. She had reversal of the graying within 1 month of use, and then the photo in the center is at 5 months post-treatment, when after that first month they had decreased from using it twice a day to just once a day, and then this is at 9 months is the third one. So pretty impressive. Clearly there is a way to reverse premature graying besides just investing in a good hairstylist. And then, going back to the fork, I was really trying to think, okay, they said hair loss. How could a fork affect my hair loss? The best that I could come up with was scalp massage and microneedling, which, as Dr. Samad talked about in her talk, we've already kind of touched on. Microneedling is an effective way to help slow down the hair loss process. We know that it works. Scalp massage, there's a lot of data supporting the use of scalp massagers, so that's something that's easy and efficient that patients can do. But certainly it doesn't have to be a scalp massage with a fork, and Dr. Zainab, it definitely doesn't have to be a stainless steel fork. Okay, let's get into something that's a little bit more serious.
Having fillers in your face while you're having a facelift is a really, really bad thing. I did a big face neck lift, eyelids, and lip lift case yesterday, and the patient had a lot of filler in her face. This added time to the surgical case because I spent a lot of time cleaning out all of this mess.
Okay, so not only do we have to worry about the energy people that are corrupting the minds of our patients, but we actually have to also worry about our colleagues, it turns out. So this guy's a plastic surgeon, and obviously he's talking about the dangers of doing filler. So I wanted to actually really take advantage of the opportunity of having, again, our plastic surgery colleagues with us so that we could have this discussion. There is currently a huge trend on social media, which is a backlash against hyaluronic acid fillers. And while I think that there is definitely a strong need for a moderation and a pullback in our use of hyaluronic acid, I think that it's currently swinging towards the other extreme. We all know that there is a definite role for HA fillers in the rejuvenation of the face. There is definite volume loss. We know that, right? And that's what fillers are for. Are they being abused and overused? Absolutely. But when you have people like this on social media that are saying oh my God, you should never do fillers in the face, and it's an absolute nightmare for us plastic surgeons if you ever decide to do a facelift. This is dangerous because then the patient goes back to their original injector and says, oh my God, why did you put this in my face, right? Or when the patient comes and they have definite volume loss and you tell them, oh, you need treatment for your temples and that's why you look so sunken and so tired and you look so unhealthy, they tell you, no, doctor, I do not want to do fillers. And that's also not correct, right? So I'm very eager to hear from our colleagues. Is there any data to support this? Let's see if I can make this one bigger. Where is it? Okay, so the only thing that I could find in the literature that was kind of addressing this was there was a survey done by the Aesthetics Society, and basically they asked they surveyed a group of plastic surgeons, asking them about the potential effects of repetitive panfacial filler injections on their facelifts. So this is essentially just the opinions of the society members. So it's not obviously the greatest data, but I think it's important to understand where our colleagues kind of stand. And basically 40% believed that a history of repetitive panfacial fillers increased complication rates compared to the 28.9 who disagreed, and about 30%, an equal number, were just like not sure. And I think that that's kind of where we're at. I think it's fairly safe to say that like too much of anything is never a good thing, and so too much filler is never a good thing. This goes back to what Dr. Narwana was saying in his talk, where like it's really important that we be, you know, selective and conservative and think about this. But so I'm eager to hear the thoughts of the others. Okay, and then this is my last video. But this is very important also. Are you doing it? Oh yeah, okay. This was all over the place. This was actually even like, I think in the New York Times, actually.
So what you're looking at here is an MRI image of a 33-year-old patient who had over 12 cc, which is 12 syringes of hyaluronic acid filler injected to her face over the past 6 years. Now the area that is green is the hyaluronic acid filler. Now, what's interesting here is that when we did volumetric analysis, that means when we measured the amount of filler, the amount of volume that was there, it ended up being close to 28 cc, which is more than twice the amount of filler that was injected. And what this shows us is that hyaluronic acid fillers are hydrophilic. That means they love water, and they also cause tissue expansion. So that's important to know. And over the next several videos, I'm going to explain what are the problems associated with these things, how do we treat them, and there is a lot of misconception about dissolving, and we'll address some of those issues and concerns. So please stay tuned and follow for more.
So this video was like everywhere in the US. So I don't know if it was trending here, but it definitely was trending in the US. And I think it touches on a lot of different and really important points. Number one, it goes back to, you know, obviously it's things that we already knew. Of course, we know that the filler is there. We know that it attracts water, and we know the source of these pillow faces, right, that people are complaining about. But I think that there's so many layers to this that we can kind of get into. But for one thing, let's focus on this idea of like long-term MRI follow-ups of the dermal fillers. So this was a case report that I found of a 47-year-old man who had been treated with filler on 3 different occasions over time. So the first year he had, and I did include the names just because I think it's relevant, but he had Restylane Lift to the lateral and medial SOOF compartments. 2 years later, he came back. They added 1 ml of Juvederm Ultra Plus, also to the Puriform Recess and the buccal fat pads, in addition to the lateral and medial SOOF. So these are so far like kind of standard rejuvenation. It's not excessive. It's nothing that like I mean, we all do this every day. And then 2 months later, he came back and he actually had 4 mLs of Restylane defined to the temporal lateral cheek compartments and to the chin. So again, like nothing crazy, right? He had MRIs performed at 2 days after the 3rd treatment, 19 months, 21 months, and then 27 months. At 19 months, there was complete resolution in certain locations. So in the prejowl sulcus, the mental crease, the mentalis, there was complete resolution of the HA filler. At 27 months, there was the resolution in some places, and there was really the chin was pretty much completely gone after 27 months. But there was still persistent HA deposits in the medial and lateral SOOF, in the places basically that had been injected the most over time. And then also in the piriform recesses, which like makes sense because this is a place where like there's no movement, right? So I think what's really important with this is that we have to get away from the idea that like HA fillers, first of all, telling them that yes, they dissolve over time. However, clearly we know that not all of the filler is going away before we're injecting the patients again. And so that's where it's so important to be mindful of like moderation in the frequency that we're bringing our patients back. That, you know, you should not be injecting your patient with filler, in my opinion, every 3-4 months, the way that you inject them with Botox. It's clearly lasting much, much longer than that. And I think we also have to be really mindful about the quantity. So one of the theories that the author of this case study had as to why it persisted in the lateral and medial soup was partly because it was the repetitive injection, and that was the side of the face that had the most filler deposited. And so of course it's going to take the longest for it to go away. I think the idea of us telling patients, oh yeah, it lasts about 6 months, the effect lasts 6 months, but the filler technically is still there. And so I think it's also important that we talk to our patients in a way that like educates them so that they are well informed. So when they see things like that, other guys' TikTok, they understand why there's still filler there. So that was kind of the, okay. And then, yes, we talked about this pretty much already. And that is kind of the end. So I'm really excited to hear what you guys have experienced in your practices. I cannot overemphasize the need to like educate your patients and also just be moderate. The days of injecting 6, 7, 8 syringes of, these like high G prime fillers all over the face are gone. So thank you.